this week's edition of RN Champions, where we meet and discuss healthcare related topics with professionals in the healthcare industry. This week, we are welcoming Mr. Timothy Vahle from Welcome to the program. Hello, Timothy.
Thank you
Tell
very
us a little
much.
bit about PFM Medical. Yes.
Uh, Thank you very much for having me. Yeah, very excited to be here. So PFM Medical is a medical device company that was started in 2001. It's located in Carlsbad, California. I work for them remotely here in Dallas, Texas. Um, we have a wide array of medical devices, including vascular access, PICS, midlines, ports. We do titanium hernia mesh, peritoneal and pleural drainage devices, interventional radiology snares, and even little devices called nidocludes that actually close up the patent ductus arteriosus for little babies that have that congenital heart defect.
Wow, I know this is a booming industry. As a nurse myself for many years, I've seen the products improve over the years with PIC lines and different devices. We're a team of IV nurses, so I'm familiar with IV access devices. And at the different conferences we go to, we see how the technology has improved. Can you speak to how what materials they use now, or how the
Mhm.
technology really has changed and improved over the years?
Sure, and I'll focus on vascular access since that's something you're familiar with too. So, in essence, our ideal customer is someone who is a clinician or works with clinicians who is really interested in leveraging the state of the art of mechanical and material engineering, both for the way that the products are ultimately designed for performance and safety, but also from a material perspective. To be able to give the patients a safe passage, if you will, for their treatment plan, and most importantly, for them to have the best opportunity to have optimal outcomes. So the materials, for example, would include the polyurethane that we make in all of our catheters, which are designed to soften with the body's temperature once they've been put inside the body. And this is great because it lowers the opportunity for things like thromboses to occur. But we also are able, from an engineering perspective, to make very small catheters that perform really, really high. We are able to achieve really high power injection rates with really small catheters. And that means we're able to allow our clinicians to do a whole lot more with their patients toward those optimal outcomes, which again is great for the patient in terms of their experience and their satisfaction.
You mentioned thrombosis or clotting of the product that has significantly improved over the years. I believe there's different products like CathFlow that the nurses use to open up these lines. And like you said, the material now kind of uh, conforms to the patient's body, where it's not so rigid and difficult. They used to break sometimes in the past. Now I think it's almost nearly impossible for them to break. Right? You can step on them and they stretch, when they're outside of the body. So that used to be a big concern for nurses in the hospital with these lines that would clot off, and now they're much better. So you mentioned the ability to flush them. Like there used to be a restriction on how fast you could do it, or the type of syringe you could use. Could you speak to that?
Mhm.
Some nurses are still a little confused maybe on what type of syringe they can use or what size. Now, I don't know. Most of them are pretty adaptable, I think.
Mhm. They really are. And with very, very few exceptions, these devices can handle basically almost anything that you're going to do with them. As I mentioned before, in terms of really working toward that optimal outcome, there's two ways that we really, again, try and work toward that for our patients. Uh, the clinical and the scientific literature very clearly states, and has for quite some time now, that you should be using the smallest catheter possible in the largest vein that's
Mm.
available for the therapy that the patient is going to be receiving. And so we have a
Yes.
catalog of very, very small catheters, which automatically goes toward the idea of optimizing those outcomes for the patients from that perspective.
Mm.
But it's also really nice that if that same patient needs to go in and have a CT scan with contrast media, for example, and they want to put this thing
Mm.
through at 300 psi or 5 cc's per second. Well, these tiny little catheters that work toward that optimal outcome can handle that type of pressure for that type of media that's going to be used for those clinical studies.
Yeah, it's amazing the advancement they've made in this industry. What what else can you tell us, or want to tell us, or tell nurses about this industry or these products, and where can they go to find more information?
Yeah, no worries. So, what I would say to a nurse that's considering us versus maybe what they're using right now would be to say, okay, look at what you're currently using. What are the sizes of the catheters that you have available? So, for example, if you're using a single lumen PICC line, let's say that's been placed, if your current PICC line, the smallest one that you have is, let's say, a 4 or a 5 French single lumen PICC line. Well, what I would say to them would be to say, what if you could have the same performance and safety that this 4 or 5 French, which is a larger catheter, can provide your patients? What if you could do the same thing from a performance and safety perspective, but you could do it for a full French size smaller for the same patient? So
Mm.
again, you're working toward those optimal outcomes while also allowing your clinicians to be able to provide the treatments that the patients are going to need based on their diagnosis and the treatment plan.
Yeah. Is there a place anyone could go to find more information on this?
Oh, sure. Absolutely. You can go to pfmmedicalusa.com, and that's our website. It'll
Okay,
have
great.
everything on it. Oh, sorry.
We're No, no. We're going to post your information on our website, iwantabuzz.com. We'll make sure there's links to everything available and they can reach out to you at their leisure. I really appreciate you, Mr. Vail, joining us today and giving our nursing community and medical field all the information you have. Thank you.
Thank you very much. And as a nurse, I'm proud to be here and represent these products and to talk to you about it as well. And I appreciate the opportunity today.
Thank you, sir.